welcome into Soda City Living. I'm your host, Madeline Stewart. This is a lifestyle show focusing on the best things to see, eat, and experience all around the Midlands. But health is an important part of any lifestyle. Today, we're learning about innovative medical procedures offered at Palmetto Bone and Joint. Dr. James Logging specializes in hip and knee replacements and says that new ways of doing those procedures cut down on pain and recovery time. You'll meet Dr. Logging and one of his patients who has undergone 2 types of procedures. Here's more. Joining us in the studio once again is Dr. Logging from Palmetto Bone and Joint. Thanks so much for being here again.
Thanks for having me.
So tell us about this Jiffy knee procedure. Last time we talked about basically what you do, what you specialize in, and we touched on this, but tell us a little bit more about it.
Yeah, so the Jiffy knee technique is really a pretty revolutionary approach for knee replacement. Typically in the past, surgeons will have to cut into the quad tendon in order to replace the knee, and that's very traumatic. It increases their pain. It also increases the chance of scar tissue and stiffness and all kinds of problems. But traditionally, that's just the way that it's been done. The Jiffy knee technique is where we come more from the inside part of the knee, so we avoid the muscle and tendon altogether, and it just makes such a huge difference in just the recovery, but also the pain afterwards, less chance of scar tissue. So there's just lots of benefits to it with the Jiffy knee compared to the traditional approach.
Now, a lot of people at home might be thinking, why haven't I heard of this before if it's such a great procedure?
That's correct, yeah. And the main reason is the guy who developed the technique, he's been doing it for about 7 years, but he just started teaching people how to do it. And he's only really taught about 10 people in the country. So currently I'm the only one in South Carolina that's offering the Jiffy knee technique, and actually in North Carolina, Georgia, Florida, there's really nobody in the surrounding area that's offering it. But when I learned about it and realized the benefit of it, I realized that was something I needed to offer my patients, because why would you not want to do a surgery that's better and a better recovery than staying with the traditional, which may have more complications with it.
Exactly, and we did touch on last time, and I want to talk about this once more, your anterior hip replacement too. So just talk about the different alternatives for hip replacement that you offer.
Yep, so for hip replacement, I do what's called an anterior hip replacement, which means we come from the front part of the hip. It's a little small incision, but the benefit of that is we don't cut the muscle, and that's what makes a big difference. Very similar with the Jiffy knee technique, we're not violating that muscle, so same thing with the hip, and that just helps make the recovery a lot better and a lot quicker. Typically, most surgeons do what's called a posterior approach, where they come from the back side of the hip. Obviously, you think about the back side of your hip, there's a lot of muscle there, and so you have to cut through all that muscle. It's very traumatic, very painful to have that done, but it also makes the recovery take a lot longer to get over, because that muscle has to try to heal, and then a lot of times it doesn't never heal fully, and so you don't get normal function back in the hip afterwards.
Right.
So that's one of the nice things with the anterior hip replacement, is that by not damaging that muscle, they recover faster, but they also get more normal function and are able to get back to being active and doing pretty much any activity they want to do.
Right, and going back to the Jiffy knee now, how long is that recovery time?
Yeah, so typically patients are up and walking right away, so they can put weight on it, they can move it freely right away. Most people do use a walker for about a week, and then a cane for a week or so after that. So usually within 2 weeks, 3 weeks, patients are getting around really well. They're already feeling better than they did before surgery.
Wow.
But there's still some swelling, a little bit, and pain, but by that point they're doing pretty good, and by 6 weeks most people are back able to do most activities they want to do.
Which just sounds crazy when you think, oh, so-and-so is going in for their knee replacement. You think they're going to be down for a long time. That's not necessarily the case.
Yeah, not anymore. The traditional approach, takes at least 3 months or more, and sometimes up to a year to get as good as it's going to get. But yeah, with the Jiffy knee technique, the recovery's a lot quicker, so patients can get back to living life, and that makes a big difference for a lot of patients, especially if people are working and they're trying to get back to their job and they want to take as little time off as they can. This is a good alternative or option for them, because it really helps them all get back quicker.
Now we want to hear from a patient who actually underwent the Jiffy knee procedure as well as the old procedure. So thanks, Kimberly, for joining us.
You're welcome.
So tell us what day-to-day life was like before you had your knees replaced.
Well, it was pain. Every time I walked, it was pain, and mine was bone on bone, excuse me, and you could feel the crunching.
Oh my gosh.
Of the knees, the bones going together. I'm a very active person, so just walking a mile, it was pain, and my knee would give out. It would just give out, and then you kind of go like this, and yeah, it was difficult.
Yeah, so you knew, I mean, you had to do something at that point.
Yes, it was bad.
Yeah, so let's go to the first procedure, so the traditional knee replacement. Tell us what that surgery and the recovery was like.
It was very painful. I would say, you know, when they ask you your pain, is it from 0 to 10? Mine was at 10, like for quite a while. It was just very painful and slow to recover. I mean, it did, but it was slow and painful.
Do you remember about how long that recovery took?
I didn't come out of my bedroom for 2 weeks.
Oh, wow.
Yeah, it was bad. I could still walk with pain, but it was a lot slower than the Jiffy.
So when it came time to replace your second knee, you were probably dreading it quite a bit, just thinking about what you had to go through with the first one, right?
I was dreading it a lot.
Yeah.
because of the pain and
the downtime.
And the downtime and the recovery. Yeah, I was dreading it.
So when did you learn about Jiffy knee?
Just a little bit before my procedure, Victoria, the PA, told me about it, and I didn't know anything about it. I didn't research it or anything, so I was just hoping for the best.
Right. So what was your experience like with Jiffy knee, the procedure, a little bit after, and then the recovery as well?
Oh my gosh. Pain never went above a 5.
Wow.
When I woke up, I could walk. Day 2, I could walk without any assistance. They made me use the walker, but I didn't really need it. Day 3, I got rid of the walker. I didn't need anything after that. After day 3, I was walking. The pain was so minimal. It was like night and day. It was wonderful.
How surprising was that to you?
I was so happy.
Yeah.
I was shocked and I was happy. It was really great. Yeah.
So I'm sure it didn't really take you much time at all to get back to that active lifestyle you were talking about.
No, in fact, I walked the neighborhood, walked, you know, a mile within a week. I was walking 1 mile, 2 mile. And the good thing is people who saw me and knew that I had the procedure, they all want to know, how come you're out here walking? How come you're doing so well? And so I've been pushing the Jiffy knee to everybody that I see. Yeah.
Everybody who thinks they need it.
Everybody that says anything about their knees are hurting, I've been pushing it because it's a huge difference. Huge.
Yeah, and I think you're in a really unique position too to be able to compare,
Yes.
you know, as one person, both procedures.
Yeah. And it's a big difference, like I said. I've played pickleball already, 7 weeks. I've already been doing that. Like I said, the pain, way less. Never got up there to the extremes like my other knee did. I mean, it's just the pain is way minimal than the other knee.
So who would you say is a good candidate for the Jiffy knee?
So pretty much any patient who needs their knee replacement, you know, obviously somebody who has pain that is persistent, it's affecting their quality of life, you know, affecting their sleep or other things like that. You know, they don't have to suffer with that. Maybe they've been getting injections or other things to try to help with it over time. But ultimately, the knee replacement is going to be the best thing to restore their function and their mobility and take away that pain.
So what's the best way to get in touch if someone wants to learn more about Jiffy knee or maybe get a consultation?
Yep, so best way would be just come in for a consultation and allow us to kind of see what's going on with the patient and then discuss it further with them so they can call our office and make an appointment. You can also go online and submit a request through the website and then our office will contact them to schedule an appointment.
Great, thanks so much for being with us.
Thank you so much.